Hello, everyone. Welcome to VMC Medical Coding. My name is Eli Rada. I am a certified trainer for medical coding and also for clinical documentation improvement. If you guys are new to this channel, please don't forget to subscribe, like, and share, and also turn on that notification so I can alert you for future videos. And if you have questions or comments, please feel free to leave me a message at the comment box and I will respond to your question as soon as I can. Here is the presentation for today. Hypertension. The classification presumes a causal relationship between hypertension and heart involvement and between hypertension and kidney involvement. So there are two conditions that hypertension is directly associated to or directly connected to. The heart, okay, heart disease right here, and also the kidney disease. So we're gonna find out in a little bit, guys, what this guideline is trying to say. Okay, so the guidelines that I just read to you guys is actually here. So linked to heart and kidney disease. Again, let me let me repeat this. The classification presumes a causal relationship between hypertension and heart involvement and between hypertension and kidney involvement, as the two conditions are linked by the term within the alphabetic index. This condition should be coded as related even in the absence of provider documentation explicitly links them. Okay, so these conditions should be coded as related. Okay, you guys see that? Even in the absence of provider documentation explicitly linking them, unless the documentation clearly states the conditions are unrelated. Okay, so I'd like you guys to highlight that in your book, saying that these conditions should be coded as related even in the absence of provider documentation explicitly linking them. So what does that mean? It means that every time you guys see a patient's chart and the patient's chart says or hypertension is documented, and in the other part of the patient's charts, you also see heart disease or kidney, the guidelines are telling us that you should connect these two together. You should connect these two together because they are directly related or directly associated with each other. Even if there is no such documentation that the doctor is linking these conditions with each other, you have to assume that they are associated. And the caveat was, unless the documentation clearly states the conditions are unrelated, but I 99.9% doubt that, because I haven't seen a doctor saying, hey, hypertension and heart disease are not related with each other. I haven't seen that ever. So but you know, the guidelines giving fairness to all stakeholders, okay, need to have that disclaimer here unless the documentation is saying so, right? So that is your hypertension being linked to these other two conditions, which is heart disease and kidney disease. Now, what is this hypertension with heart disease? Let's read this. Okay. Hypertension with heart conditions classified to I-50 or I-51.4, I-51.7, and I-51.89 are assigned to the code from category I-11, hypertensive heart disease, and use additional codes from category I-50, heart failure, to identify the types of heart failure in those patients with heart failure. So what does this guideline mean? What this means, guys, is that any heart condition whose code starts with this I-50, I-51.4, I-51.7, I-51.89, I-51.9 are assigned to a code from category I-11, which means that instead of assigning the basic I-10 code for hypertension, you are now assigning I-11. If the heart condition that you saw in the patient's charts start with this codes right here, this category and subcategory codes, you are automatically to assign or a category hypertension code to I-11, no longer I-10. And there is another follow-up instruction: use additional codes from category I-50, heart failure, to identify the types of heart failure in those patients with heart failure. So let's unpack this. Let's put that in our in a simple application guide. All right, so the guidelines are saying that, okay, you saw that the patient in the patient's charts, the patient is hypertensive, right? And also in other parts of the chart, you also saw that a patient has a heart disease that starts with those codes. Okay, I-51.4, I-51.7, I-51.89, I-51.9. Make sure that you are assigning I-11 category code instead of I-10. Now, what are those codes, guys? I want you to grab your book and let's go to I-51.4. Let's see, I'm just curious, guys, what is this I-51.4 code? Now, let's go there, guys, in the tabular, directly in the tabular, and let's look for that I-51.4. Okay. What are those codes? I-51.4. Right, let me switch you back here. Right here, I-51.4, I-51.7, 89, and I-51.9. There is also I-50 here, but let's talk about that in, after we have, discussed this. All right, so what are these heart diseases that have those codes? Now, let me go to I-51.4. I-51.4 reads, okay, I'm on page 674. If you guys are using the 2024 book, I-51.4, it says myocarditis unspecified. Myocarditis unspecified, myocardial fibrosis, myocardial NOS, or myocarditis NOS. So that means to say, guys, that you use that I-11, okay, I-11, if the heart disease that a patient has on top of hypertension is I-51.4, which is myocarditis, right? What is I-51.7? I-51.7 also reads cardiomegaly, okay? Cardiomegaly, cardiac dilatation, cardiac hypertrophy, and ventricular dilatation. So, aside from I-51.4, which is the myocarditis, what is myocarditis anyway? Myocarditis, from how I understand from the term, is that this is an inflammation of the heart muscle, okay? Or inflammation of a heart muscle. So that's myocarditis. Cardiomegaly is a term that describes enlargement of the heart muscle. Okay, so that's cardiomegaly. So I-51.7, cardiomegaly, and hypertension, how you code hypertension is not I-10, but you are to assign I-11 category code. Now, what else? Let's see here, I-51.89. Other ill-defined heart diseases like pancarditis, carditis, and I-51.9 is heart disease unspecified. So what is the takeaway here, guys? The takeaway here is that when you're reading a patient's chart and you establish that the patient is hypertensive, and at the same time, patient has other conditions like this one that we have mentioned, these ones that we have looked in the book, right? Myocarditis, cardiomegaly, and other ill-defined heart diseases. What hypertension code you are going to assign? Let's go back and read the guidelines, guys. The guideline says you are to assign I-11. And then what is this I-11? Can you guys look at I-11 category code? Let's see in the book, where is that I-11 and what does I-11 say? Let me read. I-11, hypertensive heart disease. And we know that I-11 is not a complete code because of that. Remember the icon right next to it? You guys remember that discussion that we had? Like, right? I-11 right here. Okay. And you see an icon right next to it. Everybody knows this, right? You have an icon that has a check and it says 4th, which means that the I-11, the three-digit category code is incomplete. So what is the appropriate code that you guys need to assign? You know, I'm seeing here, guys, that the I-11.0 is hypertension with heart failure, right? You're correct, Karen. Requires 4 characters, right? The I-11.0 is hypertension with heart failure. Now, those codes that I mentioned with you guys, those heart conditions that we found earlier, the I-51.4, I-51.7, I-51.89, are not heart failure, right? They're not heart failure. So, having said that, what code do you think is appropriate for hypertension with all those heart conditions that we mentioned? I-11.9. Yes, thank you, Karen. So that is the code that is appropriate when you are assigning the code I-51 point. I mean, when patient also has those other conditions. Now, so, you know, from past classes, someone will ask, hey, what if, Eli, what if a patient has atrial fibrillation and hypertension? How do I code hypertension? Now, let me throw that question back to you guys. What do you think, guys? If a patient has atrial fibrillation and also hypertension, how do you code hypertension? So, what is the code for atrial fibrillation? Does anyone know? Let me see. So, yes. So, AFib is I-48.91, right? This is your AFib, atrial fibrillation. Now, let me repeat the question. If a patient has AFib and hypertension, what code for hypertension do you guys assign? Karen says I-11.9. Do you guys agree? Should it be I-11.9 for hypertension? Yeah? Do you guys agree with that code? So Irene also agrees with that code. Okay. To answer this question, my question, okay, to answer my question, guys, let me switch back to the guidelines that I just showed you. In order for you to assign the I-11, you should have other conditions that have this codes. Now, do you think atrial fibrillation is one of those? So they're not, right? It's not, atrial fibrillation is not there. So this is what I'm saying, guys, you got to be careful with the guidelines. What the guidelines say is that you only assign I-11 if the heart conditions that you are associating hypertension with have this codes, right? Since atrial fibrillation is not one of these conditions that have these codes, so your hypertension code remains what? I-10, right? So your hypertension code will have to be I-10. You guys see now the difference, right? I-10 and I-48.91. Yes, so that's how you code hypertension. If those heart conditions that the guidelines are directly associating hypertension to start with those codes I-51, okay? Just think about I-51. Anything that is not I-50 or I-51, do not assign I-11 code. So what are other conditions that, you know, what other heart conditions that you may think of? Another condition would be, say, cardiomyopathy, right? Cardiomyopathy, I think, is I-42. What else? There's a condition that says pulmonary hypertension. So it's not, you know, it's a different code. So unless it's I-50 or I-51, use I-11 category code.